Heart disease is disease of the heart. The heart is a very important organ. It pumps blood around the body to deliver oxygen and nutrients to the metabolizing tissues. Now, disease of the heart, it's very, very important to talk about. And the heart itself, you can think about it as a pump, and a pump will have electricity that supplies and drives the pump. There is also the pump itself, and you have the plumbing of the pump, which is like the pipes that go from the pump. So we can think about the heart as a pump, and along those lines, the heart has the electric system, which is the conduction system, which generates and transmits the impulse. And then you also have the pump itself, which is the heart muscle, which will contract to pump blood out of the heart and relax to receive blood from the body, which is pumped the next cycle. And the plumbing will be the coronary arteries, which take blood into the heart muscle, as well as the outflow from the heart, which is the major arteries, the aorta, which takes blood around the body, and the pulmonary artery, which takes blood to the lungs to get oxygen. So, disease in any of these areas can cause symptoms or dysfunction in organ tissues of the body, which will manifest as symptoms, which will be talked about later on. But overall, this heart disease is very important. It's the leading cause of death in the United States and most of the developed world. And the WHO projects that by 2030, it's actually going to be the leading cause of death in the entire world as well. So this is very important. We need to pay attention to symptoms.
Well, the symptoms of heart disease can vary depending on the condition. Some patients that have heart disease can present with chest discomfort, tightness, pressure in the chest. Symptoms are typically provoked with exertion, but that's not always the case. Patients are also going to have shortness of breath, especially with exertion. They can also have shortness of breath when they're lay flat in bed. They can have lower extremity swelling. Occasionally, patients can also feel their heart beating differently, which needs to be worked up further to evaluate for any type of arrhythmia.
As bad as heart disease sounds, it is certainly a disease that can be treated, and we can change the course of our disease. There are multiple risk factors for heart disease, and these can be modified or controlled and certainly lower the overall morbidity and mortality associated with heart disease. Diabetes is number one. It's a major risk factor for heart disease. High blood pressure, high cholesterol, tobacco use, age is a risk factor. Certainly family history of having premature coronary artery disease in family members is a risk factor. Other risk factors, obesity, stress, our diet, they're all risk factors for future atherosclerotic disease, be it the heart or other vascular beds in the human body. All of these risk factors, or at least most of them, are modifiable, and we can change the course of our disease process long term. Controlling our sugar, controlling our cholesterol, making sure our blood pressure is under optimal control, diet, exercise, maintaining a healthy lifestyle, losing weight, making sure that our weight is appropriate for height, and follow the BMI guidelines. So all of these things in future certainly help lower the inflammation levels. Getting rid of cigarettes is probably one of the biggest risk factors for premature heart disease and disease. This risk factor is easily modifiable by getting rid of cigarettes. We know from studies that inflammation is lowered as we quit cigarettes within 3 days. So it's extremely important, and at any age, at any time in a patient's life, getting rid of tobacco will certainly lower their future risk of a coronary event.
Be aware that the heart is important. It's the most important force that drives life.